Sleep apnea affects 30 million Americans. Most of them don't know they have it. You go to bed at a reasonable hour, you wake up the next morning, and you are still tired. A slow, heavy kind of tired that coffee doesn't fix. You might chalk it up to stress, or age, or just being someone who doesn't sleep well. What most people don't consider is that something may be happening in their body several hundred times a night, and they're completely asleep through all of it. Sleep apnea is a breathing disorder. During sleep, your airway partially or fully collapses. Your brain registers the drop in oxygen, pulls you out of deep sleep, just enough to resume breathing. Then you fall back under, all in a matter of seconds. You do not remember it. You do not feel it happen. You just wake up in the morning wondering why rest does not seem to work anymore. The condition is as common as diabetes in the United States. It is more common than asthma. According to the American Academy of Sleep Medicine, roughly 80% of moderate to severe cases have never been diagnosed. There are an estimated 24 million undiagnosed Americans carrying this right now, many of whom have had it for years, attributing the symptoms to something else or to nothing at all. This is what sleep apnea actually is. This is what it does to your body. And these are the signs that most people miss. There are 3 forms of this condition, and they do not all work the same way. The most common is obstructive sleep apnea, a mechanical problem. When you fall asleep, the muscles in the back of your throat relax, which is normal. In most people, the airway stays open. In people with obstructive sleep apnea, the soft tissue collapses inward, partially or completely blocking airflow. The harder your body tries to breathe against that blockage, the more turbulence builds in the throat, and that turbulence is what produces the snoring. Roughly 94% of people with obstructive sleep apnea snore, which is why snoring became shorthand for the condition, though the two are not the same thing. Central sleep apnea is different. The airway is fine. The problem is the signal. Your brainstem is responsible for telling your respiratory muscles to keep breathing while you sleep. And in central sleep apnea, the signal misfires, or it does not come at all. Breathing stops, not because the throat is blocked, but because nothing told it to continue. People with central sleep apnea often do not snore at all, which is one reason it tends to get missed even longer than the obstructive form. The third type, complex sleep apnea, is essentially both happening at once. It is most often seen in people who begin treatment for obstructive sleep apnea and then develop central apnea events as a response to that treatment. It is the least common and the most complicated to manage. Severity is measured by the apnea-hypopnea index, AHI, the number of breathing interruptions per hour. Mild sleep apnea is 5 to 15 events, moderate is 15 to 30, and severe is above 30 events per hour. For most people watching this, obstructive sleep apnea is what is relevant. It accounts for the overwhelming majority of cases, and it is the form most closely tied to the symptoms that bring people to a doctor, or that should, but do not. The symptoms of sleep apnea are subtle and do not announce themselves clearly. They arrive quietly, and they get absorbed into the background of daily life, written off as stress, poor habits, or just getting older. The most recognized sign is loud, disruptive snoring, particularly snoring that stops abruptly followed by a gasp or a snort. That pause is the apnea event itself. The gasp is your body pulling itself back to the surface. Most people do not wake up fully during these episodes, which is why a bed partner is often the first one to notice. If someone has told you that you stop breathing in your sleep, that is not something to file away and forget. Daytime sleepiness is the symptom that does the most damage without being recognized as a symptom. Up to 58% of people with sleep apnea report excessive fatigue when they are finally diagnosed. And by that point, many of them have spent months or years assuming they simply were not sleeping enough without ever asking why. Falling asleep in meetings, losing focus mid-afternoon, needing a nap just to get through the day. These are not personality traits. They are data points. Doctors often use the Epworth Sleepiness Scale to measure just how severe this daytime drowsiness has become. Morning headaches affect more than 30% of people with obstructive sleep apnea. They are caused by fluctuating oxygen and carbon dioxide levels through the night, a slow, low-grade headache that tends to clear after an hour or two of being awake, which makes it easy to dismiss. Waking with a dry mouth or a sore throat points to the same mechanism, breathing through an obstructed airway, often through the mouth, for hours at a time. Then there are the symptoms that get attributed to something else entirely. Mood changes, like irritability, low motivation, and a general flatness, are common in people with untreated sleep apnea, and they are regularly mistaken for depression or anxiety. Memory problems and difficulty concentrating show up consistently in the research. One study found that up to 95% of people with moderate to severe sleep apnea had measurable attention deficits. Reduced sex drive is documented. Frequent nighttime urination, waking 2 or 3 times to use the bathroom, is a less obvious signal that often goes unconnected to a breathing disorder, though the mechanism behind it is well established. What makes this condition particularly hard to catch is that the person experiencing it has the least visibility into it. You are asleep. The events are happening, sometimes hundreds of times a night, and you surface just enough to breathe before sinking back down. The only evidence left by morning is how you feel, and how you feel has been normal for long enough that it does not feel like a symptom anymore. Sleep apnea does not have a single profile. The condition follows certain patterns, but many people fall outside them, and that is part of why so many cases go undetected. The most consistently cited risk factors are excess weight, particularly a body mass index above 30, a larger neck circumference, and being male. Men are diagnosed at roughly twice the rate of women. The researchers believe that gap is partly explained by how differently the condition presents in women, with less snoring and more insomnia and fatigue, and by how those symptoms tend to be interpreted by patients and clinicians. Age is a factor. Smoking increases risk. Anatomy matters too. A naturally narrow airway, enlarged tonsils, or a recessed jaw can predispose someone to obstruction, regardless of their weight or habits. It is worth being clear that thin people get sleep apnea. Young people get sleep apnea. Children get sleep apnea. Structural and neurological factors do not require obesity to operate. What untreated sleep apnea does to the body over time is where the stakes become more apparent. The repeated oxygen drops throughout the night place sustained stress on the cardiovascular system. People with untreated obstructive sleep apnea have significantly elevated rates of hypertension. The relationship is direct enough that sleep apnea is now considered a contributing cause of treatment-resistant high blood pressure, not just a correlate. The risk of stroke increases. The risk of heart arrhythmias, including atrial fibrillation, increases. Untreated sleep apnea is associated with higher rates of type 2 diabetes, partly through its effects on insulin sensitivity and cortisol regulation. The cognitive effects accumulate too. A neuroimaging study published in the journal Sleep found that participants with severe untreated sleep apnea showed measurable reductions in white matter integrity across multiple brain regions, changes accompanied by impaired cognition, mood disruption, and reduced daytime alertness. After a year of consistent treatment, those changes showed near complete reversal. The brain responds to being properly oxygenated during sleep, but that window for reversal is not indefinite. There is also what happens outside the bedroom. People with untreated sleep apnea are significantly more likely to be involved in car accidents. The American Academy of Sleep Medicine has estimated that undiagnosed obstructive sleep apnea costs the United States roughly $150 billion a year in healthcare utilization, workplace accidents, and lost productivity. That number does not capture what it costs the individual carrying it. If several of the symptoms described here sound familiar, the fatigue, the morning headaches, the snoring a partner has mentioned, the fog that does not lift, the next step is a conversation with a doctor, and after that, likely a sleep study. Your doctor might start with a simple screening questionnaire, like the Stop Bang, to assess your risk. Sleep studies have changed. The standard for years was an overnight stay in a lab, where technicians monitored your breathing, oxygen levels, brain waves, and heart rhythm while you slept in a clinical setting. That option still exists and remains the most comprehensive diagnostic tool. Home sleep tests are now widely available, less expensive, and accurate enough for diagnosing obstructive sleep apnea in most people. You wear a small device to bed, it collects data through the night, and a physician reviews the results. For a condition affecting tens of millions of undiagnosed people, the barrier to getting tested has never been lower. Treatment, if you're diagnosed, isn't one size fits all. CPAP, continuous positive airway pressure, is the most commonly prescribed intervention. A machine delivers a steady stream of pressurized air through a mask, keeping your airway open throughout the night. It works. In people who use it consistently, CPAP is effective in at least 80% of cases, and the documented health improvements in blood pressure, cognitive function, cardiovascular risk, and daytime alertness are substantial. Medicare and most insurance plans cover CPAP as durable medical equipment when medically necessary. There are also alternatives for people who cannot tolerate it: oral appliances, positional therapy, surgical options, and hypoglossal nerve stimulation devices like Inspire, which have shown strong results for certain patients. The larger issue is the gap between having the condition and knowing you have it. 24 million undiagnosed Americans is not a rounding error. It is a systemic failure of awareness, both in patients who have normalized symptoms they have carried for years, and sometimes in the clinical settings that could catch it earlier. Sleep apnea is not a minor inconvenience. It is a chronic condition with documented consequences for cardiovascular health, cognitive function, mental health, and longevity. And for most people who have it, the path from undiagnosed to treated is not complicated. It starts with recognizing that the way you feel in the morning is not inevitable.